Morning, Barbados, good morning. Wake up, wake up, wake up. Morning to
12 after 6, that's the time. I hope you are doing good for time this morning and you can relax, enjoy your cup of whatever and the plate, with breakfast on it, and you can take your time and enjoy it.
Start with fruit.
Yes, start with something like that. Have your glass of water and move through the courses and take your time and chew. Make sure you chew all the food.
Don't inhale.
No, chew it. It digests better. There's a process, so we're trying to give you some good, helpful tips. So watch the TV in the kitchen, on the bar, you have that little TV there, you enjoy it. And Dr. Andrew Ford is here this morning, so you'll get some tips, some information on.
Impetigo.
Yeah, I don't want to get the inflection wrong. Good morning, Dr. Ford.
Good morning to everyone, yes.
Good to have you here. So where do we start with this? Let's give a definition first of all.
Well, impetigo is a superficial bacterial skin infection, and it is highly contagious. That's the important thing. It can affect all age groups, but it tends to affect children more than adults, and it loves the face and any other part of the body that can be involved.
Wow. What does it look like? How does it manifest?
Well, we think we have some pictures of that.
Okay.
Impetigo usually starts as a fluid-filled vesicle and some erosions, and that fluid-filled area can change into a pustule, but eventually you get this honey-colored crust stuck on the skin. So it can occur in any place on the body. Very infectious, as I said.
Such colorful description.
Yes, always. Yes, that's actually a very important characteristic of impetigo. But another thing is a spreading infection. We really get worried. This is someone, a child with impetigo around the nose. The nose is an area where bacteria can live, especially in recurrent infections. And impetigo on the nose is extremely common.
So why does it seem to go for these areas so
Well,
much?
any area that gets an excoriation in impetigo can be either primary or secondary. And in the primary case, that's in skin that's really normal. And someone with a boil or impetigo passes it on to another individual. But in the secondary cases, it's when you have a skin problem. Let's say you have eczema, or you fell down, you had an erosion or an abrasion. The break in the skin makes you susceptible to it. So the important thing is that it can be spread from one person to the other.
Can it go into the hair as well?
Yes.
Yes,
Oh,
we have
there we go.
a child who had tinea capitis. We'd spoken about that sometime earlier. And this impetigo is a secondary event. You see the honey-colored crust very clearly there on that one.
Okay, that must be very uncomfortable and difficult to deal with. I mean, how do you really deal with it when it's in the hair and you have all that to manage as well?
Well, the important thing with impetigo is to soak off that crust, because you can't get on the skin to treat the infection if the crust is there. So wet soaks that contain white vinegar, usually get like a half cup of white vinegar, dilute it to 1 liter with tepid water, soak the area for 10 minutes several times a day, remove that crust, and that crust then allows you to put an antibiotic preparation on it. And there are several types of antibiotic preparation. You can have fusidic acid, you can have mupirocin as well, and there are others that you can put on. If it's just a simple and not a very severe infection, then putting that on for 10 days can be enough to treat the infection. There's some cases where the infection may be recalcitrant and difficult, and in that case then you'd have to resort to some oral medication, oral antibiotics, usually a type of penicillin or a broader spectrum antibiotic, and you can treat the infection that way.
Okay.
But the cases that you showed us were predominantly, as you mentioned, the upper area. But what about those who would not necessarily have it on their face, but they end up with it on their legs, or within the hands and legs area?
Yeah.
Is that possible as well?
That is possible. I think there was a picture as well of someone with eczema who had it on the legs, and you can see that tendency towards these cyclic or oval areas with crusting. And that child is a child with eczema who secondarily developed impetigo. And as you would expect in Barbados, where we have many sandflies and mosquitoes, people can get their insect bites impetiginized. That's what we say. That's a secondary word.
That's what I was about to mention, because I remember my daughter actually had an allergic reaction to mosquito bites. And then the next thing I knew, they said she had impetigo. And I went, how
Yes.
did this happen? That's supposed to be highly contagious.
Yeah, it is. The thing is that, as I said, having that break in the skin makes you more susceptible. And it's important to carry out measures to prevent spread of the infection. So you have to sometimes cover the wounds. You have to soak the wounds. Any clothing that has the liquid on it, you have to wash that clothing and also keep it away from people. If you have impetigo and there are people in your family with eczema or with insect bite allergies, you have to stay away from them. You may not have to be quarantined, but you have to be careful. Hand washing is going to be important. The towels you use, the pillowcases, if
All
you
those things.
use a washcloth, you know,
The
you have to be
couches.
careful with that. Yes, you have to do things to prevent the spread. Of course, if you have impetigo, then you shouldn't really be at school until the weeping stage and any
Yes.
fluid-filled areas and crusting have been removed. So you find that in schools or in nurseries or even in a household, impetigo can spread. And you know, if there are children who are always playing and wrestling and doing stuff with each other during the vacation, and there's impetigo there, it can spread. Another thing is that for the doctor, it's important to figure out what's primary impetigo and what's secondary, because even when you treat the infection, if there's something there that breaks the skin, then you have to take care of that so that the individual will no longer be susceptible to the impetigo.
Okay. Okay, I know you said it's contagious, but what causes it to start with? Did you explain that?
Yeah, it's bacteria, Staphylococcus aureus and strep pyogens, and they need a break in the skin. But there's some people who are carriers. We all pick our nose at some time or another, and the nasal cavity as well as the armpits in areas where, in cultures where people don't bathe a lot, are are places that can be carrier sites. So if you, even if you take antibiotics, you can have bacteria living in your nostrils that will not be treated with that antibiotic. So as you do your nose picking and doing stuff and you're not washing your hands, you can spread it.
You've just totally spoiled
I'm trying to
breakfast.
eradicate nose picking in Barbados.
Please do.
But,
Or brain picking,
so-
as
so
I see
the-
sometimes in driving.
So the only way you can really treat that carrier site is by treating the nostrils with a topical treatment for about 3 weeks. That way you get rid of the bacteria, and that person won't be a silent carrier all the time. You can actually verify that someone has the bacteria by doing swabs. That's taking a little sample, send it to the lab, having it analyzed, and you'll see that. But even though impetigo is very common, it can be easily treated, as I said. Antibiotics work very well. But the important thing is to recognize it. If it's early, you do the soaking and try to keep the skin clean, put the antibiotic on, and just try to keep that person away from others that can get the infection.
All right. Okay. Well, we're going to take a short break, and then we're going to continue our conversation. But we also want you to ask Dr. Ford any questions that you may have, so you can get the numbers ready. Keep it handy and dial away. You should have your questions written down because you know when our experts will be here, right, Kimberly? So 228-5562 or 228-5563. Those are the numbers to call. We'll take a short break, and we'll continue in a moment. We're back with you on Morning Barbados, and we are talking about impetigo. Dr. Andrew Ford is the dermatologist with us this morning, and you're welcome to call and ask any questions that you may have regarding this particular infection, or of course any other things re the skin that you may want to get into. So, Dr. Ford, how do you make people, is this uncomfortable? Is it painful? Impetigo, how do you manage it while the person's dealing with it? Because I mean, your colorful descriptions don't make it sound comfortable at all. You know, honey-colored crust in your hair and near the mouth and all those other
On the
areas.
face, yeah.
No, it's
Well, I guess the social aspect is important. Someone with impetigo isn't the most beautiful person to see, you know, with all these exudates and dried liquid and crusting. So, as I said, soaking it off is very important. But the areas can be sore and stick to clothing. That's a big problem. So, especially when you have it in an area that's covered by clothing, you may have to cover the lesions so that you won't have someone walking with their clothing stuck to them. But it's important that if you have impetigo, you know, probably the best place for you is at home. And we did mention that even though it's contagious, it's not extremely highly contagious because most of the parents that take care of children with impetigo don't get impetigo. It's really the individuals that have some predisposing thing that causes them to get the infection once they're exposed to the liquid.
okay. So, can it lead to any other problems, like something as serious as kidney problems?
Well, you can be unlucky enough, especially with insect bites. If you get a secondary infection, there's a small proportion of individuals, probably less than 1%, that can get kidney infection and manifest itself as something called nephrotic syndrome with decreased kidney function and swelling of the legs, which can be quite serious because the kidney is one of the vital organs. So that's something that we really have to look at, because I find here that people are not as aware, and they don't work as hard to prevent insect bites, which
All
they
because of
think
the
is just
insect bite.
cosmetic.
Yeah.
But the insect bite is a portal to all the bad bacteria that's out there that can do things to you. And even though people have it for years and nothing happens, there's usually the unfortunate youngster who gets a kidney infection from that.
Okay.
So that's important.
All right. This is. I hope that this is helpful to you. By the way, that question came from a caller that was a little shy.
Okay.
Didn't want to go on the air, but I hope that answers your question and you feel a little bit more prepared. As we talk about this, I remember things like cellulitis, because we were talking about insects. So explain exactly what that is and how that can happen and how you handle that.
Okay, cellulitis is another superficial skin infection. It's not usually a contagious one, but this is one that affects the upper layer of the epidermis and just below that. So it presents as a redness, a diffuse redness, which is warm and can be tender. But this individual usually is ill and can have fever, can have swollen lymph nodes and that sort of thing. Other than cellulitis, there is another infection called erysipelas, which is a kind of cellulitis at a deeper layer, at a deeper level, but it's recurrent because it occurs where if you've had some surgical intervention or you had a wound, the bacteria lives in the lymphatics and gives you sporadic or intermittent recurrent infections because of that. So cellulitis is especially important if you're someone whose immune system isn't functioning the way that it should, or if you're diabetic. These infections then become very significant because in those individuals they're not as able to fight off infection as others, and the antibiotics have to be right in order to get that person better. And in all cases, there's discoloration of the skin after, and that's one of the sequelae of impetigo that we have to look at. Barbadians are very concerned about marks, or they call them scars. But with impetigo, you get a discoloration. It's usually lighter or darker, but in the long run, it becomes darker, especially in people of color. And it only lasts for maybe about a month or so, and it goes away.
Okay.
Only if you get a deeper infection, which can be a consequence of impetigo, something you call ecthyma. All these things have different names, but then the injury can be deeper and worse, and the discoloration lasts longer.
Okay. You know, we often have to think of the doctor. We run to the doctor when anything goes wrong, Kimberly. Who does the doctor run to? I mean, how do you take care of yourself with all these things that you have to treat? You know,
Well,
I mean, I'm sure you're not in this because you're squirmish,
No.
probably like me.
Yeah,
but
it's not. You can't be squeamish and be a doctor. But luckily, once you use all your hygienic practices, doctors hardly ever get anything from patients except for maybe viral illnesses and respiratory illnesses. And doctors hardly ever go to the doctor. I'm not really sure why. Doctors die suddenly and mysteriously.
Whoa.
But anyway, the important thing is once you have your hygienic practices in tow, then you'll be fine. But impetigo is very, very common. I'm sure that when people see those photos, they'll recognize it and they'll know what to do. Sometimes people end up trying to use antifungal creams and that sort of thing. And you know, I think the programs are doing very well. Just from our melanoma program last week, I saw 2 patients with suspicious lesions that look that way, that probably would not have sought
so
attention
they
otherwise.
saw Morning Barbados.
Yeah, we're
and
getting
said,
through to people.
Let me
We're
come and
reaching
get
people.
this check. Very good, very good. We're happy. We feel like, you know, something
doing
is happening.
something,
Yes,
yeah.
you're doing something right if people are coming forward.
I think you almost branched out into a slightly different area as well. You find that as parents, we often bring our children on the first sign of anything. But as adults, especially as we get older, we find ourselves less and less inclined to see our friendly
right.
doctor or but yours truly falls prey to that as well. I've been seeing mine less and less. So how do we encourage, you know, those out there that if there's anything that you see coming up on the skin that just doesn't look like normal, or it wasn't there before, that they should get it checked out?
Okay. First, I'll say that you 2 girls look great. But
Thank you.
but certainly, we're educated enough as a population, and our literacy rate is high enough. You know that if you have a problem with the skin, hair, or nails, the dermatologist is someone you should see, especially if it's persistent. Of course, you do have options of seeing your general doctor. Your general doctor can handle lots of things because general doctors are trained in some aspects of dermatology as well. But anything that changes or is persistent or bleeds or just is weird, you know, you should have it checked out rather than suffering silently.
Yeah. So you mentioned that this mainly affects children, going back to impetigo, but have you seen instances where an adult developed impetigo,
certainly,
and is it treated
especially
differently?
adults tend to get it more from the secondary causes. Like you can have eczema, psoriasis, or you can just get a wound and you know, be diabetic, have something going on. So adults obviously do get it, and very seldom you can see the parents of the children presenting with it as well. So all age groups can get it. You could even have, let's say, something as simple as a cold sore and get
I was
impetigo
going to ask
secondary.
if it can be mistaken
so
for something like that.
Yes, evidently, because it occurs around the mouth so much and around the nostrils, anything that has fluid in it is
attract.
you know,
So
can be
what
misinterpreted as a cold sore.
So what about this Bayesian term, prickly heat?
Yeah.
It can impetigo be surrounded?
Yeah, certainly it can. It doesn't happen very often, but prickly heat is a heat condition, a heat rash where the sweat glands are blocked and you get very tiny pinhead bumps with little bits of fluid, or they're just very red. It tingles and stings in the sun, and that is something that chronically turns into a bizarre-looking eruption that can look like eczema. So once you're scratching, anything that you scratch or that causes a break in the skin can have impetigo as a secondary thing.
Wow.
Now, you going back to the cold sore, you mentioned that, and you hear people say it got a fever.
Yeah.
What is it really?
A cold sore is an infection caused by the herpes virus. Usually on the mouth it's type 1, but it can be type 2, because you know the type 2 is related to genital infections. But the thing about the herpes infection is that it stays into a part of the nerve in the individual place called a ganglion, and it comes back when your immune system is compromised, or you're under
Fighting
pressure,
something.
or let's say some people get it with women can get it with a period, or lots of sun exposure, stress, or you get the flu or the cold. It manifests itself in that nerve ending, that sensory area, and you get grouped vesicles, and then you get these vesicles turn into pustules, and then you get an erosion just like you would with, and crusting just like you would with impetigo.
Right.
So it's obvious why that would be confused. But the thing about it, the cold sore doesn't often spread unless you have your immune system is really shot, and you get it all over. But with impetigo, the important things are the crust, the yellow crust, honey-colored crust, and the tendency to spread. And these tendency to oval or lots of oval or polycyclic lesions, but spreading is the big thing. And you have it here one day, and you look the next day it's somewhere else.
Yeah.
And where you had a cut or a scrape.
All right. That
Honey
honey-colored
You've
crust
had enough of
is
this.
going to stay with me today. All right, I won't
No
be
more honey
baking
for you.
any pie or anything.
You took
No.
the words straight from my mouth.
No. All right, so we hope this has been helpful and informative to you. Thank you very much, as always, Dr. Ford. And then we hope that you continue. When you see anything, you just run to the doctor and let the good doctor help you out. That's what it's all about. Thank you very much. Have a good
Okay.
Monday.